Strokes are the most common cause of physical deformity and the third most common cause of death. With this severity and prominence in our world, it is important to inform people of its risks and symptoms. Strokes are a major health problem in the United States, partially due to an increase in unhealthy eating and lifestyles. I believe people should know what a stroke is, the risk factors and symptoms, and what life after a stroke is like. Although strokes are fairly common in the health world, many people don't know or understand what they are. According to Med India, a stroke is where blood supply is lost to the brain when the brain doesn't get enough blood. When the brain doesn't get enough blood, that means that there's no nutrients or oxygen also getting to the brain cells, which causes them to die. There are 3 different kinds of strokes: ischemic, hemorrhagic, and transient ischemic attacks. Ischemic strokes are where arteries to the brain are narrowed or blocked. When this happens, the blood can't get to the brain. They can be treated, however, by drugs that break up the clot. They're the most common kind of stroke, with 85% of strokes being this kind. Hemorrhagic strokes are when blood vessels dealing with the brain hemorrhage or burst. You need surgery to fix the broken blood vessels. And when the blood vessels burst, there's not a clot so that the blood can't get there. It breaks, so the line, kind of like the artery, the line is just ruptured, so the blood can't completely pass through. And then transient ischemic attacks are where blood flow is only partially stopped from the brain, only temporarily. And this is less severe. It is dangerous, but it is less severe. But the problem is that when people have an attack like this, a third of them will have another stroke within a year, a major one. According to the Center for Disease Control, there are many risk factors, and they're kind of broken into 3 categories, which are medical conditions prior to having the stroke, lifestyle choices, and also genetics. For medical conditions, there's high blood pressure, which is just where the blood pressure, like the pressure in your arteries, is too high. High cholesterol. Cholesterol is a waxy substance in your arteries, and when it builds up in your arteries, it creates a plaque, and then it can either get stuck on the sides of your arteries so blood can't pass through, or else it can get kind of bunched up and then form a clot in your artery. Heart disease plays a role in it, especially coronary artery disease, heart valve defects, and irregular heartbeat. Diabetes plays a role because of the excess sugar buildup. And then also sickle cell disease, which is where your red blood cells are sickle shaped, and so then when they go through the bloodstream, they can get caught up in your artery, and then there will be a clot there. For lifestyle, it's mostly unhealthy diet, which is a diet high in saturated and trans fat, cholesterols, and sodium. Also physical inactivity, obesity, excessive alcohol, which will raise the blood pressure and increase triglycerides, which is a fat in the bloodstream. And also tobacco use, which can damage the heart and blood vessels. It raises blood pressure, and it also reduces the oxygen in the blood. For genetics, there's family history, age, which is how old you are. When you turn 55 and up, when you get 55 to 65 and 65 to 75, every 10 years it doubles the chance that you're going to have a stroke. Also, what sex you are. If you're a man, it's more common for you to get a stroke. But if you're a woman, if you have a stroke, it's more likely you'll die from it. Also, race. Blacks, Hispanics, and Native Americans are more likely to have strokes, and African Americans are actually twice as likely as Caucasians to have a stroke. Some symptoms are confusion, difficulty speaking like slurred speech, headaches, unconsciousness, vomiting, numbness or paralysis, especially on one side of the body, trouble sleeping, dizziness, and bladder or bowel control problems. According to the medical news today, a way to diagnose someone who's had a stroke by yourself is you can do the FAST method, which that is face drooping, which is where one side of your face, the person's face, will droop down, as in this display. Then arm weakness, which is where when you ask them to put both of their arms up, one arm they'll have trouble keeping up, or they won't be able to keep up at all. Speech difficulty, which is where they'll have slurred speech, they'll sound almost drunk, you won't understand what they're saying, and then they don't understand or comprehend exactly what you're saying. And then if this happens, this is time to call 911. And the reason it's time to call 911, if any of these symptoms occur, not all of them, but even just one, is because someone needs to go to the hospital 3 hours after they have a stroke, because the blood loss which have more and more blood vessels dying. In the hospital, they have a different diagnosis. They have physical examinations, blood tests, a CT scan, which is the main way to figure out what kind of blood, if you have a blood clot or a hemorrhage, because they can look at the picture and see if the blood stops and there's like a clot or if it's all over the place. MRI scan, which is where they use radio waves and magnetic waves to detect damaged brain tissue, so they'll know what kind of areas were affected. A cardio ultrasound, which will check the blood flow in the arteries. A cerebral angiogram, which is really cool. You actually inject dye into your arteries, and then it'll go throughout the bloodstream in your brain. You can see exactly where the blood's going, where it's not going, and you can see that under an x-ray. And then an echocardiogram, which is an image of the heart, which will see if there's any sources of clots in the heart. For treatment, as we discussed earlier, hemorrhage strokes require surgery. Ischemic strokes require blood thinning medication, but rehabilitation is mainly what happens after you treat the actual blood clotting and hemorrhaging of the stroke. It includes like speech therapy, physical therapy, which is kind of just rebuilding the muscles and how to work them, occupational therapy like eating, drinking, driving, writing, and then also support from others. Because after a stroke, a lot of symptoms that people have is an inability to use one side of the body, because if the blood clot is in the left side of your body, it affects what you do on the right side, your motor movement, and if the blood clot is on the right side of your body, it affects your left side of movement. So an inability to use one side, confusion, difficulty with emotion, communication problems, decision-making skills, and also depression. So strokes are a major health problem today, partially due to an increase in unhealthy lifestyles. I believe people should know what a stroke is, what the causes and symptoms are, and also how to treat a stroke. And after today, hopefully you will be able to use the FAST method to help someone who's had a stroke if you ever have the case happen to you.